Hello, good morning, and welcome to today's episode of Spotlight on Senior Issues. This is a series of programs focusing on topics that are very, very near and dear to the hearts of our senior community as well as the children and families of our senior community. My name is Kelly Hook, and I'm happy to be your host today, and I will be introducing to you Stacey Childs today, who will be discussing something very interesting regarding Medicare, Medicaid, and some topics of concern to those of us who are going to be turning 65 at some point here shortly. So, Stacey, welcome.
Thank you. Thank you for having me.
Stacey, the first thing people are going to ask, and actually I asked, was what in the world is CLAIM?
Yes, we do hear that quite often. CLAIM stands for Community Leaders Assisting the Insured of Missouri.
Wow.
Yeah, that's kind of a mouthful, you know, the acronyms in government. But each state has its own SHIP program,
Okay.
which is the State Health Insurance Assistance Program.
All right.
And the SHIP for Missouri is called CLAIM.
CLAIM. Okay, very good. So tell us a little bit about what CLAIM does.
Okay,
and
thank you.
how CLAIM got started. Has it always been available? It seems like maybe a best kept secret.
It is known as Missouri's best kept secret, honestly, but it has been over 20 years.
Oh, wow.
Yes, and we've been very fortunate in Missouri. I'm very passionate about the program, and we have so many volunteers. Other states are not blessed with as many volunteers as we are. What we actually do, I have a number of community partners and counselors that actually educate and provide advocacy for those soon to be 65, those on disability that are going into Medicare, and even those that have been on for many years may have questions. And we can provide that advocacy and assistance to anyone or family members.
So how much does it cost the person needing help?
Great question. Our programs are completely free.
Okay.
We provide this at no charge at all. We are not affiliated with any type of insurance, so we make no commission.
Okay.
We're simply here to provide that needed assistance on something as difficult as Medicare.
Right, and I know we've said it before, Medicare seems to change on a daily basis. So for 2015, what months are we looking at soon for the general enrollment for people who are turning 65 this year?
Yes. We have what we call the open enrollment season. It has so many different names. It's just called Part D, open enrollment, a wide variety. That starts October 15th, and it runs through December 7th. And at that period of time, we advise everyone to take a look at their prescription drug plans and their Advantage plans. They may be very satisfied with the plan, but let's say they started a new medication, and come January, if they had not checked, there's a possibility that those meds would not be covered on that plan.
Right, because each of the plans has a formulary, which is basically the list of medicines that they are going to cover the following calendar year, to put it simply, right?
That's exactly right.
So just because your Medicare medication plan covered your diabetes shots this year doesn't necessarily mean that they will cover them next year.
That's exactly right, Kelly. And the plans are supposed to disclose this in written form about the 1st of October, but when you receive Medicare, you receive a stack of mail like this, and they sometimes don't know what to keep and what to look at. So they may have been informed, but they had no idea. So if they do not, then check their plan, and they could be out just hundreds of dollars that they might not need to be out. That's where we come in. We can actually take the medications that they're on and put them in a software program through the Medicare.gov system, and then we can actually provide them with the information on some of the best plans available that would cover them. out
But you're
there.
not affiliated with an insurance company. You're not
Not at all.
selling any plans.
Not at all. We do not sell, and in fact, we have a stipulation that no one of our counselors could have been actively involved in insurance for 1 full year before they become a
becoming
counselor. Simply just so that it does not look like we're trying to steer someone either way. We can provide them with choices, and then it's up to them to make that decision on which plan, which insurance company they want to go with.
Right, right. So, for those of us or those people turning 65, a lot of people have sort of they just think that I'm going to be on Medicare, I'm going to sign up, and I'm never going to have to pay another bill again. It's going to cover my medicine, it's going to cover my hospital visits, my
Exactly.
doctors. It'll cover my nursing home until the day I die, and I'll have no more worries. Can you help us with that?
That's scary because some people do, and they're shocked when they start receiving some of those bills. Medicare was never set up to pay 100%. Kind of like what we're experiencing in our normal insurance world. It covers about 80%. And so that 20% then is left up to the individual to have to cover.
Right.
They also think that their drug plans are included. Under original Medicare, which is Part A and Part B,
Right.
A being their hospitalization and Part B being more of a doctor, the medical side, the drug plan is separate. And so an individual does also need to enroll in a prescription drug plan as soon as they turn 65 also.
Okay. All right.
And this way it will cover their medications that they're on, and Part A and B will pick up the hospitalization, doctors, just all of that except for that 20%.
Right. So there's still also deductibles on some of those. Is it deductible on Part B?
There is. It's been the same for 2 years, so it's a very low deductible, but still it's $147
Okay.
for the last 2 years. But each year they have the right to adjust
To change that?
Yes.
And some of the drug plans have deductibles as well?
They
or-
do. They do. The government does set guidelines, and any one drug plan cannot have a higher than $320 deductible.
Okay.
Some of them have a zero deductible. But again, we could go in, it's
And
based
look at
on,
that.
right. We get to pull
it
all
has
that
to
up.
provide basically the same coverage, right?
That's right.
So,
When we go in and visit with someone, we like to know exactly what their coverage has been before
Okay.
Medicare, so that we can keep that exactly as close to it so that it will cover what they have been covering. And they'll come in and say, well, my neighbor's on XYZ, I want that one.
Right.
We pull it up and look, well, they may have to pay $500 a month for that one medication that their neighbor was not on.
right.
And people
right.
don't
And
realize
they don't realize that.
No,
Right.
they do not. So there are things out there that Medicare does not cover.
Right.
One of those things you mentioned, long-term care. And that is something that individuals do not realize. And so we really try to be an advocate for them to understand they need to start planning now,
Yes.
knowing that Medicare, it picks up skilled nursing after someone has been in the hospital and they may need rehab or anything
Right.
like that. Then based on criteria, then Medicare will help pay for that.
So my understanding is when Medicare is paying for nursing home services, they have to be, the patient has to be improving. So physical
Absolutely.
therapy, occupational therapy.
You're exactly right.
They're improving and they're seeing that things are changing and getting better.
Absolutely.
So Medicare is going to cover that up to how many days?
The Medicare, if you have been in a hospital and been admitted for 3 full midnights, then you are allowed 20 days that Medicare will pay 100% for your skilled nursing, and you will not have to pay out of pocket. And then after that, days 21 through 100, then the individual pays at 157.
Okay, okay. So you had a a way to kind of, I mean, I get so confused, A and B and C and D and F and G and almost all the letters of the alphabet now in a Medicare. So you had an easy way of kind of remembering what each section covers. And let me see if I remember this.
All right.
Medicare Part A, if we think about it as admissions.
Absolutely.
So admission to the hospital, admission to the nursing home, and there's some other
Exactly.
things.
Very good.
Part B is the part that's going to cover outpatient things.
Exactly right.
Like doctor's visits, if I had to have an x-ray done, if I had to have a surgery done in an outpatient facility.
Absolutely.
And then our C are sort of a special category that are our Advantage plans, which are kind of the Medicare HMO of today.
Absolutely.
Okay, and then our D's are drugs.
Right.
I don't know if that's a great way to
That's
do
it.
it,
Well,
but D equals drugs.
That's right.
And then we've got some other policies that would be considered to be Medigaps. Talk about what Medigap is and what it does.
Absolutely. Well, I originally said that Medicare was not set up to cover 100%. So that 20% that it does not cover and the individual's out of pocket, we kind of think of that as a gap.
Right.
And so we want to help them cover that gap. And so that's where Medicare or Medigap then is a supplemental plan.
Okay.
That based on the program that they choose, and there's many different, again, it's A, B, up to F, and they can choose that based on how much coverage that they would like of that gap covered, and of course, the premium. Right. All different
So Medigap is something that is definitely going to require a premium, and premiums vary, right?
Premiums vary, yes, and they could go as far as just the basic plan all the way up to what we call the Cadillac Medigap plan, meaning that if they go into the hospital, normally when someone enters the hospital, they are immediately responsible for that deductible, which is $1,260.
Okay.
That's just it. However, a Medigap, when it comes into the picture, it takes care of that.
So they don't have to worry
No,
about
they are
paying
not
the
out
deductible.
anything. I have a counselor who is on an F plan, and he has been in and out of the hospital just this year already, I think 3 times.
Wow.
Has not paid a dime out of pocket.
Because his Medigap is...
Right. Now, he does have to pay monthly premiums.
Right.
So he's paying a monthly premium, but then he has a surety that if anything happens, it will cover. He has nothing out of pocket.
How can claim help you determine? I mean, I was looking at something and it looked to me like in Missouri there's probably 50 different companies that do Medigaps.
Exactly. There are many different ones that provide. We always recommend that an individual, if they have an insurance agent, to check with them first, and if they're an independent agent that sells a variety of different types of insurance plans, they would be able to help them.
Okay.
If not, they could refer them to someone. A Medigap is something that we at Claim cannot actually enroll them with.
Okay.
They do have to go directly to a licensed agent. So, of course, we have to be biased, and so we cannot recommend anyone, but we just say to them, if you know someone and you're comfortable with, start there first.
Right.
Whereas the Advantage plans, referred to many times as Part C, are something that we can be involved with and actually enroll them into these. Yes, the Advantage plans and the prescription drug plans, the Part C and the Part D. We at Claim can sit down, counsel with them, and then actually enroll them in one of these programs.
Okay. One of the things that I thought was interesting about the Medigap plans is that, again, each company may have a different premium to be paid, but an F plan is an F plan at Mutual of Omaha, it's an F plan at wherever else you buy it.
Great point. That is so true. And the world out there isn't always honest with us. And so they're always trying to sell something.
Right.
And that's where we take pride, and we don't sell anything. So therefore, we are not encouraging them to go a certain way. However, if they go to, like you mentioned, Mutual of Omaha versus XYZ company and choose an F, Medigap plan, and then annually they have that opportunity to shop around.
Okay.
If their plan has gone up $34 a month, $30 to $40 a month, then they may, let me see if there's another plan out there. So like you said, if they're on a Part F plan with one insurance company and switch to another insurance company and stay on Part F, they receive the exact same benefits. So don't let anybody say, well, if you're paying $50 less, you could not be receiving all of this.
Benefits, because
Like
it's
you
not
said,
true.
An F is an F is an F.
Now, is the enrollment period for Medigap the same time of the year as the enrollment for Medicare A and B?
It is. It all depends on the individual. Okay. When an individual turns 65, then they have a 7-month window.
Okay.
3 months before, the month of their birthday, and 3 months after.
Okay.
So at that time, then they can enroll in Parts A and B and prescription drug plan.
Okay.
And then they can choose if they want to go with a Medigap plan. So that, when they turn 65, could all be done at the same time.
Okay.
However, once they are enrolled in this GAP plan, then that person's anniversary date each year becomes their open enrollment. Okay. So that an individual 30 days before their anniversary date will begin to start checking out the other companies to see if there's a cheaper plan.
Okay, so if you want to make some changes to your Medigap, you need to start doing that about 30 days before your year is up.
Start checking into it and finding out what, if there is, you know, the greatest thing is if you can stay on the same, with the same insurance.
Well, my parents love that. They don't want to change.
People don't.
I talked to my mom the other day, and she said, we've been with Mutual of Omaha. We don't want to change, but their premium is now going to be going up. And I said, Mom, we need to shop.
Absolutely.
Do some shopping around for,
it's so true.
For your Medigap.
So true, and we so encourage that. So that would be an annual, and so each one of us would have different open enrollment for a GAP plan. But if they're on our other side of Medicare, the Advantage plan. Mm-hmm. And the Advantage plan is simply a different way of actually receiving the Medicare benefits.
Okay.
These are private insurance companies that work with the federal government to provide A and B coverage.
Okay.
But they also get to kind of put in some of their own rules along the way. There may be different premiums, there may be different cost sharing, co-pays. All of this can be decided by that private insurance plan, but the overall coverage of A and B does have to be legally the same for those under Original Medicare versus those under an Advantage plan. They just get some additional. They may get some vision benefits, they may get dental, they may get hearing, whereas unfortunately Original Medicare does not pick up
cover vision,
those three
hearing.
that I just said.
So that would be one of the or a few of the advantages of the Advantage plan. What might be a couple of disadvantages of the Advantage plans?
One disadvantage would be a service area. If an individual purchases, like say they live here in the Joplin area and they look for an Advantage plan, they do have to enroll in one that services this Joplin area. So then if they are, let's say, visiting a daughter out of state and they have to go to the doctor, they would be out of the service area. And they may be out of pocket.
That's something people need to know.
Very important.
Because so many seniors travel.
Absolutely.
And we've got our snowbirds that always summer in Florida.
Absolutely.
So an Advantage plan would not be a great plan for them.
No, they would really need to check to see that service area, and most of them are local within where they live. Whereas then Original Medicare, the opposite side here, they both are covering the same A and B coverage, but Original, you could go to any doctor across the United States. Yes.
Okay.
Yes.
For our seniors who love to go on tours and overseas for trips and senior trips, what are some special, what's something special they need to be thinking about with regards to their Medicare plans?
Okay. There are some of the Medigap plans, these supplemental plans that we've been mentioning, that do also cover part of foreign travel. So that is something, yes, so that may be of interest to one person and not at all to the other. So they've got plans out there according to your interest. However, we always say that it's important to know if it were an emergency, Medicare is obligated to
cover
pay
it.
and to cover you for that emergency. But we know sometimes then, once you're stabilized, they do lots of other things to
yes,
you.
yes.
So it's important to have some of that foreign coverage.
Right.
So you might even consider a whole different insurance plan
Just for foreign travel coverage.
Yes.
If you're in a
And
foreign
if
country.
you're going through travel agencies, sometimes they offer that, or your credit cards.
Right.
But we do have to be a little cautious on the traveling because Medicare, is just within the United States.
Yeah. Changing our steam a little bit here, a lot of people get confused between Medicare and Medicaid. What's an easy way to remember what the difference is?
Okay. Medicare will cover anyone that is over age 65 or those that have been disabled and have been on disability for 2 years.
2 years.
For a full 24 months. Okay. Then they will automatically be rolled into the Medicare program.
Okay.
And then, of course, there's the aging in, those that are 65. Now, that is not a program based on financial
need.
Right. Whereas Medicaid is a program that is based on the individual's income.
Okay.
And so you have to fill out a lot of information, and then they would go in and check your monthly income and all of your different assets. And based on that, then you would be eligible for many different assistance programs. So Medicaid, which is really now called the Missouri Health Net, yes, is one that is for individuals that are in the very low bracket of the federal poverty level, whereas there are many different assistance programs that can help individuals that may not be making a whole lot, but they're still not eligible for something as detailed as Medicaid. And we can go in and help them. We can help them apply for these different programs that then would pick up coverage for these drugs. We could also help them with what we call Medicare savings programs that, based on eligibility due to their income, the government would help pay for their Part B premium.
Wow.
So there's some wonderful assistance programs out there.
So these assistance programs, a claim counselor is going to know about these programs,
Yes,
and
ma'am.
somebody who's struggling with paying their medications every month should be calling claim
Yes, ma'am.
rather than doing what I've seen people do, which is let me take my pill. And this is so sad. I see this with
Very
my
sad.
seniors all the time.
Yes.
Let me take my pill every other day for my blood pressure so
Very
that
sad.
I can make my blood pressure medicine that's costing me $60 last 2 months instead of just 1 month.
That is
Or
right.
I just don't take my medication at all because I can't afford it. So calling a claim counselor could very well result in
Yes.
somebody being able to be on the medication the doctor needs them to be on, be able to take it the way the doctor wants
That's
them to
right.
take it,
That is right.
and not have to pay so much out of pocket. And they don't. These are for people who are not on Medicaid, right?
Absolutely, absolutely. It could be someone this year, a single person could make up to $1,500 a month and still qualify for an assistance program called Extra Help.
Okay.
And that particular program pays a very large portion of their prescription drug premium, cost sharing, many
Wow.
different. And like you said, the saddest thing is when we talk with someone and they are trying to decide between food and their medicine.
Yes.
And I cried over hanging up the phone, knowing when we've been able to help someone and they then can take their medicine as needed, and sometimes it's at no charge. Sometimes
Right.
it's at a few dollars a month. It's a wonderful feeling to be able to help those people. They may have never heard of these programs.
Right. Well, I hadn't heard of them
Right.
before a few
Right.
days ago.
Yes.
And I was thinking, if a client could call claim and actually get some help with their Part D program so that they had the right drug coverage
Yes.
program that would cover their medicines, and then possibly qualified for some assistance,
Absolutely.
that could actually save them a huge amount of money each month.
We have saved people from $200 to $1,500. If they're on medication that's unbelievably expensive, we have been able to save them that kind of money by just going in and finding the right plan, that their medication is on that plan's formulary. And then
Right.
two, if they are not making very much money, then we can sign them up for these different programs. And that's what we take pride in, is we do not just answer a question.
Right.
When they call us, we try to visit with them and let them know that there are programs that are out there that could help them in paying for this. Well, anytime we tell someone we could save them some money, they're interested.
Right.
And we're then taking them and explaining to them, and it may be that if they make too much or if they have too much in assets, then we may not can help as much.
Right.
But if they do not, we can just provide them with so much information, help them enroll right then, and then they would be eligible and would be starting to receive this assistance.
Right, right. And it's better to ask.
Absolutely.
And at least find out.
Absolutely.
So, do you have any sort of parting comments, advice for families of seniors that need help with their Medicare, or any parting advice for our listeners?
Well, we are very excited to help any of the family members, and sometimes we encourage that because it is so complicated.
Yes.
That particularly, let's say we have an 85-year-old individual who thinks that she knows what to do, but in a sense has been scammed
Right.
by someone, and her family may not know about it. They just are helping her to pay the bills, but they don't realize. And so we try to bring them into the picture also and let them see, and they then are able to then annually say, Mom, now let's remember, every year from October 15th through December 7th, let's check out your plan. Let's just make sure. Whereas, like we said, sometimes our grandparents don't like change. So if I'm with this company, I'm just going to stay. Yeah, they sent me a letter and my bill's going up $50 a month, but I'll just try to make it. They do not have to do that.
So, Stacey, tell us where to go for help, who we can call, and what number to call, and where we can find help.
Thank you so much. We, like we've said earlier, are the claim program, the SHIP for the state of Missouri. And you can call our call center,
Okay.
which that number is 1-800-390-3330. By calling this number, we have customer service representatives that are always available, and they will take just a small amount of information. They then, depending on where the beneficiary lives, will then forward that information to one of my counselors down
Very
here in
good.
Southwest Missouri, and we can call them back and set up a time to help them.
Awesome. That's great. Thank you so much for
Thank
being
you
with
for
us,
having
Stacey.
me here.
Appreciate this information, and I'm sure I'll be calling you for help this year with my folks.
Exactly.
Thank you, listeners, for listening today. Appreciate and hope that you will see us next time on another episode of Spotlight for Senior Issues. Thank you, and have a great evening.